Okay, welcome everyone. We're here for our July health chat meeting. I'm with myself, Anita Clark. I take care of the student activity accounts and benefits, employee benefits at Grambling Schools. And we're joined here with Nicole Miller. She's our account manager at SETSEC. And also Amy Minkley. She's the relationship manager at Trustmark. It looks like we may have at least one staff member. Is that correct? Do we have Jen Kisham with us?
Yep.
Yes.
She just sent in the chat, said hi. So, yep.
Okay, sounds great. Thanks, Jen. Welcome. And if you have any questions, we'll leave room at the very end of the presentation for questions. So with that, I'll go ahead and turn it over to Nicole and Amy.
Hi, everyone. So I'm going to go ahead and start sharing the presentation. We'll go through the presentation. Once the presentation's done, we'll stop recording so that we don't get any HIPAA violations and questions. And then, Jen, if you have any questions at the end after the presentation, we'll go from there. All right. Does everybody see the full screen version, I hope?
I see the full screen, but I also see the slides down the side.
Yeah, same here.
This one that my mouse is on? Okay, let me see if I can get it over, sorry. How about now? Oh, how about now?
Yep,
Oh,
there we go.
Oh, okay, sorry. Always tricky when I gotta do this. All right, so there's our title screen that this month for July, we're having our health chat with Amy and Nicole. All right. So the first topic we're going to
wait a minute. It looks like I can proceed and move you, so I'll move you. That was weird.
Oh, yeah, it is. Okay. So the first screen that we have here is the first topic we're going to talk about is changes you can make at open enrollment. So open enrollment happens once a year. The district allows you to make any changes. This is if you want to change to a different plan, if you need to add a dependent that you hadn't previously added, you can do it now without a qualifying event. If you need to delete a dependent, you can do that now without a qualifying event. And if you need to terminate your coverage altogether, you can do that now without a qualifying event. So open enrollment is your one time every year to make whatever changes you need without a qualifying event.
Oh, maybe it was you that did it. Oh.
Maybe. So then the question comes, well, why can't I change things outside of it? So you can make changes outside of open enrollment only with a qualifying event. So some of these qualifying events are like marriage, birth or adoption of a child, divorce, death of a spouse or dependent, or changes in your enrollment status, or I'm sorry, your employment status that would cause you to gain coverage or lose coverage for you and your dependents. So if one of those happen, you would need to submit your paperwork to Anita in the business office within 30 days. You only have 30 days, and the effective date of the change is the date of the qualifying event. So if you were to get married on June 1st, you would have 30 days, so you would have till June 30th to submit that paperwork to Anita because you got married and you want to add your new spouse on. The effective would be June 1st, the date of marriage, but you have to turn in the paperwork by June 30th. If you have a new child, the day the child is born, they're eligible to be enrolled on your insurance the date they were born. So if they were born July 1st, again, you have 30 days to get the paperwork to Anita, but their enrollment date would be July 1st. That is all I have. Kind of a high level to cover, you know, what open enrollment is and when you can change outside of open enrollment, just to clarify some of those. These are our most requested situations. So now I'm going to turn it over to Amy to talk about the explanation of benefits.
Perfect. Thank you, Nicole. So from an explanation of benefit standpoint, anytime, what an EOB is really what we call it. Explanation of benefits is summarized as an EOB. Anytime we process a claim that is received on your behalf, you do receive what is called an EOB. The EOB will outline all the services that were billed and what was paid accordingly. So when you get your EOB, it'll look similar to this. It'll tell you it's from Trustmark. It'll let you know that if you have any questions, you can contact us at this number. You can also visit the website, which is our portal. You can also go in there and also send a message to the portal if you have a question about this EOB. It does identify, you as a member, an employee on here, and it also will provide you with your employer name and the date that this EOB was printed. Okay. From there, when you have it, if you have a family, you're going to get a consolidated family EOB. So anytime we process any claims for the entire family, it will be all consolidated on one EOB. If you're an individual and you're just a single coverage, then of course that EOB will just represent your information in the claims that processed for you. The EOB will be sectioned out and will identify who the claim was for. And as you can see in the first box, it says illustration Ivan. That's for the first patient. So it tells you that this is what this claim is, who this claim is for. And then it will also provide you with a claim number. It will also tell you who the provider is. So this will tell you if you went to the Real Surge Center Nowhere, that is the provider for this particular claim that we processed. From there, it will also tell you the network that this claim processed under. So Cofinity is the network for Grand Blanc. So this would identify Cofinity. You also have a wrap network called First Health, and it could be identified as First Health as that wrap network. Or if it's out of network, it would identify that it is out of network. So it's important to pay attention to the network that it processed under to ensure that you're utilizing a network provider for services. Then you go into the contents of the actual EOB, and it'll tell you the type of service. We do not list out the specific services. We do categorize them just from a PHI standpoint. We want to make sure that information, your protected health information, if someone picks up your EOB, they're not able to say, oh, John or Ivan went and, had, finger surgery. So we really keep it generalized to make sure that no one can identify the type of services that were received if it fell in their hands. From there, we also provide you with the service date. So it'll give you the service dates of that service. And then it'll give you the bill charges. So bill charges is what the provider has submitted on their claim. From there, the discount amount will identify the contractual relationship that they have with Cofinity or your network. So there's a discount that's applied, and then once that's applied, then the rest will fall into other categories. Other adjustments are going to be situations where something falls into really the provider responsibility and not necessarily your responsibility. Other plan payments, which is the next box, is going to be coordination of benefits. So if you have a dependent that might have other primary coverage, that primary would have paid for the services, and then we would apply that primary payment to this claim and then coordinate appropriately. So that's in the event of other coverage for yourself and or other dependents, but it has to be primary. So that's what the other plan payment is. Then the next several boxes are patient responsibility after payments. So once we process this claim, we process the discount amount. If you or your dependent has any type of patient responsibility, it's going to fall into these categories. Ineligible is going to be any services that are not covered. Your copay, of course, is going to be your copay that applies to that service, so like an office copay. If you have a deductible and you have not met the deductible, that will be in this section. And then your coinsurance. So if you have met your deductible and now you have to meet your co-insurance, that will apply in this section to show you what that breakout is. From there, it goes into the plan benefit. So that's basically saying that the plan, Trustmark is going to make a payment to the provider in the amount of $24.15.15. The plan's paying at 90%, which is the next box, and then it's going to show you your patient responsibility. So it's going to take your eligible, your copay, your deductible, co-insurance, and it's going to put it into that patient responsibility section for you. Any questions in regards to that? Okay. One thing I would like to note on or make a comment on relative to your EOB is we always recommend that if you receive an invoice from your provider saying you owe X dollars for this data service, we highly recommend you always confirm that you have an EOB. And you can confirm that by going out to the website, making sure you're registered on our portal. You can go to mytrustmarkbenefits.com, as we noted at the top of the EOB. And you can look for that data service, you can look for that provider, and you can actually pull up your EOB. If you happen to shred it or what have you, that information is always available on the website for you. So we always want you to compare your EOB to your invoice to ensure that you're being billed appropriately. Sometimes providers will bill you prior to, they'll send you a statement saying, potential balance due is this, and they're still waiting for a payment for us. And a lot of members get confused thinking, well, I owe this money, and they go ahead and pay it, and then in the end actually owe less. So we always want to make sure you have that EOB to back up the invoice that you're receiving from that provider. From an EOB standpoint, as Nicole has highlighted, if there's additional claims that we have processed with the claim listed above, it's going to list them. They're going to keep listing on this EOB. So for illustration Ivan, in this case, we had 2 claims. If illustration Ivan had a dependent and it was illustration Susie, then Susie would be separated, and then the claims for Susie would be identified on this EOB as well.
I had one question, Amy.
Yeah.
What is the difference between deductible and coinsurance?
So deductible is the first out-of-pocket that members have to meet. If they meet the deductible, then they go into the coinsurance, and coinsurance is usually a percentage. The deductible is a set amount, say $750. So the member has to meet that initial $750 deductible, and then once that deductible is met, if there's a coinsurance for services afterwards, say of 20%, then the coinsurance would come into play at that point.
Okay, thank you.
You're welcome.
I don't think the Grand Blanc plans have coinsurance on it, but this was just a sample EOB that we had to use. So it does show it on here.
Yeah.
Okay.
Yep.
And that coinsurance column will be on every explanation of benefits, but if you don't have coinsurance, it would just remain 0.
Correct. Yeah, so if it's just a deductible and then it pays at 100%, then it would just show the deductible. Once that's met, then it'll show that the plan paid at 100%, and there would be no patient responsibility from there.
Okay, sounds good. And then I believe most if not all of our employee groups should have no coordination of benefits. So if they're with health insurance through Trustmark and Grand Blanc schools, that should be their primary and only insurance.
Well, you might have, do any of the potential members with dependents, in some cases they may have dependents that have Medicaid.
Oh, true.
But in that case, Medicaid is the payer of last resort. So yes, Trustmark would still be the primary.
Okay.
So,
Yeah, good point. Thanks.
Yep. Okay. All right, next slide. And then when you get to the bottom of the EOB, this will actually identify the out-of-pocket. So this talks about your deductible as well as your out-of-pocket maximums that must be met. So In the event, again, it's a family consolidated EOB. If there's multiple individuals, it's actually going to show you, in this case, Isabella illustration, her out-of-pocket that's been met per this EOB is $1,111.82. So that's what she's met of her $6,600 out-of-pocket maximum. Then down below that, it shows you that she's met $750 of her $750 deductible. So this is where you're going to see your in-network and out-of-network, out-of-pocket and deductible maximums and where you're at as far as meeting them. Once you meet your deductible, it'll show again here, that it's been met. And then from an out-of-pocket standpoint, once you've met your out-of-pocket, in this instance, if this individual had met $6,600 of their out-of-pocket, then the plan pays 100%. But until then, you will continue to have co-pays or co-insurance until that out-of-pocket max is met. So you'll have prescription co-pays, you'll have office visit co-pays. Those things will continue to accumulate to go to the out-of-pocket. So this at least will be able to tell you where you're at as far as meeting your deductible and your out-of-pocket for each of your family members, and then as a family as a whole. The one thing I want to note above this section is the reason code descriptions. When we process a claim, and I did not go over this on the previous slide, but there's always a reason code at the end of the claim processing. So all those boxes, it'll say reason codes. There are times that we, if we deny a claim, we're going to tell you why we denied a claim in its totality. Member may not be eligible, or we're waiting for information. So for instance, we might be waiting for COB information, or we might have requested accident detail. There's always a reason on why we deny something, and we always provide some explanation to give you an idea of what is going on with that particular claim. In this case, it's just telling you that, the reason code was AET, and it's saying that patient's not responsible for the Aetna PPO discount. So again, as you notice above in the previous slide, there's a discount column that's telling you that you are not responsible for that PPO discount. Any questions on this?
I think the only thing that I wanted to outline, which is why my arrows keep popping up, is where it says preferred provider total and preferred provider deductible. That means that they were in network, meaning they participated with the Cofinity network, and the other one that says non-preferred is considered out of network. Yeah. So these will always have your in-network and out-of-network totals per person on it. And then as you'll see, Isaac's on here. Isaac didn't have anything, but if he had any claims for the year, they would be there. And then again, at the very bottom, it totals the whole family.
Yeah. And typically your out-of-network deductible and out-of-pocket is higher than your network. So that's why we encourage you to always ensure that you're seeing a network provider, so you're not incurring higher out-of-pocket costs when you're seeing those out-of-network providers.
I believe that is the end of our slideshow. Of course, if you guys ever have any questions, you can reach out to myself. My contact information is here, and I believe it's also been emailed around. I will figure out how to stop sharing my screen. There we go. And I'm going to stop the recording.